Assalamualaikum warahmatullahi wabarakatuh. Hi ladies and gentlemen, I'm Junita Sumara. You can call me Junita. And today I will present to you about even rate of autoimmune disease in child patients at Bali. I'm gonna show you guys about the backgrounds, aims, method, results, discussions, and conclusions. Let me get started from the background. It's what is an autoimmune disease mean. So an autoimmune disease is a condition in which your immune system mistakenly attacks your body. The immune system normally guards against germs like bacteria and virus. When it senses there's foreign invaders, it sends out an army of fighter cells to attack them. The immune system under normal circumstances is able to differentiate itself from non-self in maintaining integrity host. An interventions or disturbance that occurs may result in an overreaction to self-antigen, which causes autoimmunity. Significant increases have been observed in autoimmune disease worldwide. However, the etiology and pathogenesis of this autoimmune disease remain unknown. Those classified as autoimmune disease include juvenile idiopathic arthritis or GIA, and then multiple sclerosis, systemic lupus erythematosus or SLE, type 1 diabetes mellitus, and then Graves syndrome, scleroderma, and multiple sclerosis. The exact number of people with autoimmune disease in Bali is unknown. The number of SLE cases based on data from the Bali Provincial Health Office was 25 cases in 2012, and then the latest data in 2013 saw an increase in the number of SLE cases reaching 75 cases. The prevalence of SLE is estimated at 1 case per 2,000 population with an incidence of 1 case per 10,000 populations. And then we go to aim. Uh, the purpose of this research is to obtain data on the incidence of autoimmune disease in children in Indonesia's Sanglah Hospital, Denpasar, Bali, and this study can provide an overview of autoimmune disease in children in Bali that useful in the treatment of pediatric patients. So let's we next move to materials and methods. So the research materials is the material used in this study with medical record data of pediatric patients with autoimmune disease as well as the registrations book for all pediatric patients. And then this research method is done with useful study observational research type cross-sectional, which aims to determine the incidence of autoimmune disease in children after receiving ethics and permissions from Sangla Hospital. And the data were obtained from medical records and registers of pediatric patients treated at Sangla Hospital age 0 to 18 years who met visit outpatients, inpatients, or emergency in the period January. Then the data analysis is presented descriptively to determine the incidence of autoimmune disease in children at Sangla Hospital in the period January. And then let's move to the results. So there are two tables. Table 1 is percentage of each type autoimmune disease. So the types of autoimmune disease are SLE, diabetes mellitus type 1, acute rheumatic fever, juvenile idiopathic arthritis or GIA, and autoimmune hepatitis. Then table 2 is the distributions of case by type gender. So during the study period, there were 50 cases of autoimmune disease consisting of a total pediatric patients visit. This total amount was obtained from outpatients, inpatients, and emergency departments. The acquired autoimmune disease can be seen in this table 1. So SLE is the most common case, which cover 50% as we look of the total case of autoimmune disease in Sangla Hospital in the period of January. So other autoimmune case include type 1, it's diabetes mellitus, it's 30%, acute rheumatic fever 10%, GIA 8%, and autoimmune hepatitis just 2%. And then we move to table 2, distributions of case by type gender. So based on table 2, the majority of case of autoimmune disease in children, it's 35 cases occur in women with a ratio of the number of cases between men and women of 1 proportionate 2.3. So gender difference in autoimmune disease may be due to difference between male and female immune system. In this study, it was found that in other autoimmune diseases such as type 1 diabetes mellitus and the other, which were also found to be more common in women than men. And thus results are in line with other studies which have shown that women are more susceptible to autoimmune disease than men. And then meanwhile, type 1 diabetes mellitus, based on the results of a study in Sweden states is that the prevalence of this disease was relatively the same between men and women. And then let's we look at this next table. In this table, table 3, it's viewed from the age group. The highest prevalence of autoimmune disease in Sangla Hospital occur at more 10 years of age. It's 74%. And then this table 4 is age distributions in women with autoimmune disease. And so we can look, its table 4 is this is in accordance with the result of research at Sangha Hospital, which show that the majority age was in the group of women aged more 10 years, which was the age of puberty compared to that of. And then the discussions. So the risk factor for autoimmune or age, so more 10 years more get risk of autoimmune. And then gender, so women are more risk are more have risk of developing autoimmune than men. And then race, in the American study, African American were at higher risk than Caucasians for SLE types of autoimmune. So based on the results of the study, so SLE is a disease with the highest incidence in children compared to other types of autoimmune disease. In research conducted by Bill shows that the number of cases of SLE in the children is about 8% to 15%. So we can see that men have greater immune suppressions when compared to women. Females show a large increase in immune reactivity, which can translate to greater resistance to infections and some non-infectious diseases. However, it is possible that this greater immune reactivity makes women more susceptible to developing autoimmune disease. In addition, estrogen and egg factors can also affect the high number of autoimmune events in women. This estrogen hormone begins to be active at the age of puberty. This is in accordance with the result of research at Sangla Hospital, which saw that the majority age was in the group of women aged more 10 years, which was the age of puberty, compared to the age of 10 years, which was the non-pubertal age. Can we see at table 4? So the autoimmune disease usually start when the child is 10 until 14 years old, and the data obtained are in line with the results of a study conducted at Sangla Hospital, which show that the highest number of autoimmune patients was found in the more of 10-year age group. This is probably due to the effect of telomere shortening, which is more experienced by children at 10 years old more. And then telomere shortening at each cycle of cell replication is associated with the aging process of cell. This cell aging process is thought to increase the risk of autoimmune disease such as GAA, SLE, and type 1 diabetes mellitus. Based on other studies in the United States, it was stated that SLE and GIA most commonly start at the age of 15 until 40 years. And then the age of TDC is 15 until 50 years is the dominant age affected by type 1 diabetes mellitus. The same prevalence is also shown in autoimmune hepatitis, which predominantly occurs at the age 15 until 40 years, while in the disease, the majority of acute rheumatic fever occurs in children aged 5 until 15 years. In addition to gender and age, racial background that varies between individuals can affect the incidence of autoimmune disease. Certain racial groups may be at higher risk for some disease and lower risk for others. In the American study, African Americans were at a higher risk than Caucasians for SLE, but were at lower risk for type 1 diabetes, while other autoimmune diseases such as GIA were reported to have a higher incidence of insidious groups. America is in Pima, India in research conducted by Feldman. So 38.5%, while for Asia it is 4.2% associated with obtaining the incidence of autoimmune disease in pediatric patients at Sanglah Hospital Denpasar, and it is hoped that this study can be used as a starting point for subsequent studies related to autoimmune disease in children in Bali. And then the conclusions of this presentations is the incidence of autoimmune disease in children at Sangla Hospital Denpasar in the period January was 50 patients out of a total of 22,081 pediatric patients. So the percentage of incidence was 0.22%. So autoimmune disease in the form of SLE is the most common autoimmune disease that occurs in 25 of 50 patients. The highest age was over 10 years of age, with the highest prevalence occurring in women. Okay, that's my presentations, and the source you can be find it in this link. Thank you for the attention. Thank you, ma'am. Thank you all. Assalamualaikum warahmatullahi wabarakatuh.